Okay, good morning everyone. We're just going to start in a few seconds. I'm just going to be recording this webinar and it's Tuesday the 4th of August. Hope everyone's well. So I've just popped everyone on mute and feel free to use the chat bar and unmute yourself if you want to ask a question. So just firstly, apologies, on Friday the webinar did not record. We had technical problems at the practice and we weren't able to record anything on Teams, so apologies for that. And there is something I will share from that meeting that was quite important. The first thing I wanted to update you on is thinking about a second wave or an outbreak in your practice and what you need to do if you need to notify people about an outbreak or a practice closure. So the first thing is to let the head of primary care know in the CCG, and there is a standard email address that you would need to let the CCG know in Barnet, and I'll share that email address in the chat bar. It's so that everyone knows how to get in touch. So I've just popped that email address in the chat bar for colleagues. And once you've emailed them as well, you'll also need to let the London Coronavirus Response Cell know. And what they now come and do is do a risk assessment and advise practices and what steps they need to do to make sure the practice is secure in terms of any other risk assessment or anything that they need to do. Now, a definition of an outbreak is any incident where two or more persons have the similar or the same disease or symptoms linked. And that's a standard kind of definition used. So I thought that's really important for people to know. And what I'll also do is give you the contact details for the London Coronavirus Response Cell as well. I'll pop that in the chat bar for colleagues as well, just so you have that information as well. So I'd pop that maybe in your mobile phones as some information, because it's quite good to have handy. These things tend to happen when we're unprepared. So do share those information with colleagues. The next thing I wanted to let you know about is that Edgware Neurological Rehab Centre has reopened, so the NRC, and the NRC is accepting referrals from GPs as it has previously. So the condition really is somebody who's got a neurological condition like multiple sclerosis or motor neuron disease or cerebral palsy or an acquired brain injury, spinal cord injury or ataxia. That's the general rule of thumb. Anyone that requires assessment and or therapy or intervention, and they might require monitoring for a long-term condition or be on the LTC register. So you can email them to get referred in if you think your patient needs rehab. And again, I'll share with you on the chat bar the email address for the NRC at Edgware, so that you can refer in if you feel you have a patient. So I've just sent that in the chat bar as well. The next thing I wanted to talk to you about, I've had lots of questions about face coverings and what does that mean for us. Now, as we know, face coverings are now mandatory in public places, and we've had patients contacting us in practices seeking verification of exemptions from the GP. So there is, just to be absolutely clear, I've looked into this, and there's no requirement for an individual to prove they have a valid case for exemption if they cannot wear a face covering. Therefore, as GPs, we're not expected to provide verification of exemptions. And also, just to be clear, which is really, I didn't know this until I looked this up, but it's apparently not a legal requirement in a healthcare setting for people to wear a face covering or face mask. So that's meaning people that come in for their GP appointment. Now, in my practice, we ask every patient to wear a face mask, and if they don't have one, we provide them with one, unless they obviously say they have a reason you can't wear one. But the government actually has said that you should wear a face covering in an enclosed space if you can, including primary care services, but it's not a law, and we can't refuse entry to somebody in the premises if they refuse to wear a face covering. But of course, we should communicate clearly to patients and ask them and offer them face coverings or face masks. It's a personal choice. Apparently, it's not in the law. The other thing I wanted to share with you is, if you are asked and you do decide you want to provide somebody with something to have as proof, because some people might feel more comfortable having something on their phones or printed out to say that I can't wear a face covering. In the chat bar, I've just sent you another link today, which is something you can share, and maybe on AccuRx with patients, that they can download and have on their phones, which says I'm exempt from wearing a face covering, and that has been produced by the government. The next really interesting thing I wanted to update you on was about the COVID recovery website that's just been launched. So as we know, evidence shows that a significant proportion of post-COVID-19 patients are likely to have significant ongoing health problems, potentially breathing difficulties. And there's an article yesterday I read about in the BMJ about about 8% of these patients having some sort of fibrosis of their lungs on a permanent or long-standing basis, which is quite worrying. And obviously it's too early really to tell what the long-term harm is for these patients because we've only got a few months of data. But certainly breathing problems, tiredness, cough, reduced muscle function, particularly if they've been in hospital, difficulty or in undertaking physical activity, or PTSD or reduced mood. So there's a new website created by the NHS called Your COVID Recovery, and the website is literally www.yourcovidrecovery.nhs.uk. And again, I'll pop that in the chat bar for you, which you can share with patients. So really what that website is for people to go and have a look at who are recovering from long-term effects of COVID-19 and to support them and manage their recovery. And it includes information from rehab experts on to how to manage different symptoms depending on what symptoms they have. So I thought that's a really good resource for us to give to our patients. The next thing I wanted to tell you about today was some of you would have received a letter last week from NHS England, Skipton House, about the third phase of the NHS response to COVID-19. It's a long document, but I thought I'm going to summarise it in about a minute. And there are three phases to this response. The first phase is, and this is valid from August, is accelerating the return to near normal levels of non-COVID health services, making full use of the capacity available in the window of opportunity between now and winter. And the second bit is preparation for winter demand alongside continuing vigilance in the light of further and probable COVID spikes locally and nationally. And then finally, doing the above in a way that takes account of lessons learned during the first COVID peaks, lock in the benefits or the beneficial changes, and tackle fundamental challenges, including support for staff and action in inequalities and prevention. Now, if we break that down into what part of that is relevant for us in general practice, well, there's three things that they really have talked about in this letter. And that is that we should be restoring services in primary care. And they've asked us, and I'll quote, they've asked us to make rapid progress in addressing the backlog of childhood IMS and cervical screening as a really key factor. And they've also stated that we should be really aiming to deliver the PCN DES requirements from the 1st of October. The next thing that they've said is that we should continue to build on our work in the care homes and doing reviews and medication reviews, which I think we're all doing particularly because of the LCS in the borough. So I think that one we can tick off. And the final thing is really expanding the range of services that we are signposting people to self-refer to. So really this is saying to patients, actually, there's a lot of things that you can seek self-help about, and NHS England believe that will free up clinical time. What is also written in the letter is it's contractual that we must offer face-to-face appointment at the practice. And this is really, it's not specified for hot and cold, but certainly in Barnet we have the hot hub, so we should be definitely seeing all of our cold patients. And we should be continuing to use remote triage and video, online and telephone consultations where appropriate. Now, as you might have seen, Matt Hancock said something last week about, the future is probably going to be us doing digital triage and remote triage going forward as a permanent thing. And I know there's lots of debate about that and whether it's, could miss things. So as food for thought. I'm going to pause there for questions. Tao, you've mentioned, what about face-to-face for routine chronic disease, diabetic patients, COPD checks, etc. So I think what the letter's emphasising is that we should do everything remotely where possible. But for example, in my practice from this month, we're going to restart diabetic foot checks because that's something you can't do remotely. It's going to be for that for most things. So, the person can go and have their blood test done for diabetes. Some of them can do their blood pressures, but most of them are going to have to come in for a foot check, a blood pressure, even maybe the blood test at the practice. And then you might do the rest of the consultation remotely. So the education, talking through the results. Similar with a COPD, they might come in for a breathing test, and then so instead of being in the room for half an hour, they might be in the room for 15 minutes, and then you might do the rest of the consultation remotely. So lots of different ways of working. I think each practice has got to decide what's right for them. It also depends on your facilities, how big your practices are, how many nursing or doctoring team you have. I think that they're all factors. So there's no guidance on what exactly prescriptive we should be doing. Now, things like breathing tests, like spirometry, remember that could potentially be an aerosol generation. So they haven't specifically asked us to restart any breathing tests. So I think that's just something as a thing to be aware of. So anything you think could be aerosol generation should be not restarted right now. And as I said to you last month in July, they were re-encouraging us to start joint injections. And they've made that absolutely clear in the August letter that we should restart joint injections where it's clinically appropriate, and we absolutely shouldn't do joint injections when people are unwell, because actually steroid can actually be really potentially harmful for patients. So I'll stop there for any other questions from anyone. And again, as always, if you do think of anything, pop it in the chat bar and I can get back to you. Nick Mystery mentioned something about Finchley Memorial. Our Finchley Memorial open for minor illness. Yes, so they've always been open for minor injury, but not minor illness generally. So they're trying to stick to minor injury. If a minor illness does come through, they're probably going to see them, but really, you know, it should be for minor injury. And as you know, Edgware Walk-in Centre is being used by the hub, and X-ray being a walk-in. So I'm not convinced about that, Laura. I think still they are wanting appointments. I don't think they're going to be asking for any walk-in appointments for X-rays at the moment because of the risk. So I think, as far as I'm aware, we haven't had any official comments from the Royal Free to say that you can't, you can ask patients to walk in for X-rays. So I'd recommend we still follow the same process that we've been doing. We've been emailing the X-ray forms, and until we hear otherwise. I know there's been lots of talk about that, but the no official thing has come through from the Royal Free, so I'm going to suggest we continue to do what we've been doing, is emailing X-ray forms. Okay, everyone, I'm going to say thank you for joining me this morning, and I'll see everyone on Friday morning. Enjoy the rest of the week. Thanks, everyone.
Thanks, Nick.
Take care.
Thank you, Nick.
Cheers.